We respectfully acknowledge that the Windsor Regional Hospital occupies the traditional, ancestral, and contemporary lands of the Niswi, Iskwandonwa, Anishinaabe, the Three Fires Confederacy, Ojibwe, Odawa, Potawatomi. We acknowledge the land and the surrounding waters for sustaining us, and we are committed to protecting and restoring these lands and waters from environmental degradation.
Welcome, ladies and gentlemen. It is now 17:01. I will call this Board of Directors meeting of the Windsor Regional Hospital for November 6, 2025. I'll call it to order. Are there any declarations of conflict of interest? Seeing none, we will move on to item 3, which is the approval of the previous minutes of the October 2nd, 2025 Board of Directors meeting. I will move, I need someone to move a motion. Linda, and seconded by Geneviève. Thank you. Are there any questions or discussions? Seeing none, all in favor? Motion is passed. Thank you so much. We move now to the report of the President and CEO and Chief Nursing Executive, Karen and Nicole.
Thank you, Mr. Chair. I'll just wait for Matt to pull up the presentation. So on to the first slide. Just an update on our strategic direction number 2, fostering an inclusive culture of accountability and transparency. We hosted our quarterly town hall meeting on October 23rd. So we had our senior team and our NWRH project team there, providing an overview of the work completed to date for the new hospital planning, and it provided an opportunity for all of our employees, affiliates, and professional staff to ask any questions that they might have. We had over 100 people in attendance, great engagement, and we look forward to continuing this forum to keep our teams and the broader community involved and engaged in this historic healthcare system redesign. If you haven't had a chance yet to complete your engagement survey, I've got the link there on the presentation, and you can also find it on our hospital project page. Next slide, please. We also, under our strategic direction number 3, maintaining a responsive and sustainable corporate financial strategy, we were pleased to accept, in partnership with our Windsor Police Service, that pairs our frontline officers with nurse professionals to deliver proactive care to people struggling with substance use and mental health challenges in our community, a $500,000 grant, which will enable our NPT to continue providing on-scene treatment to those in need for our community. Initially, we launched this as a pilot project in May of 2023, and it was expanded to run 7 days a week the following year. So officers and nurses are on the road delivering critical care between 1 p.m. and 1 a.m. daily. And in the first 9 months of 2025 alone, we handled over 1,900 calls for service, distributed 80 doses of naloxone, made 291 referrals to community resources, and diverted 436 potential visits to our hospital emergency rooms. Our program has attracted attention across North America, mainly due to its operational success. And this $500,000 investment from the Ontario government will equip the Windsor Police Service and Windsor Regional to cement this program as a mainstay of our community's emergency response model. Next slide, please. We were also happy on behalf of the Windsor Regional Hospital Foundation to thank the Funkenhauser family for its ongoing generosity. Gunther and Judy are set to present. They had been set and did present the Windsor Regional Foundation with a check thanks to their funds raised from the annual Trevor Lewis Funkenhauser A Day for a Life golf tournament in honor of their son Trevor, who passed away tragically in 2006 following a courageous battle against endocarditis. With the most recent donation of $13,300, their grand total to date is over $200,000, an amazing legacy for their son and a life-saving gift for our community. Next slide, please. We were also thrilled to announce the grand opening of our newly renovated 4 West Atrium, renamed the Stephanie and Barry Zackelman Atrium, designed specifically for patients and their families. So this serene space provides a distraction-free environment where loved ones can gather and spend quality time together away from the clinical setting. The revitalization of this area was made possible through a generous contribution of $100,000. Shift Interiors handled the design and furnishings, and we have an amazing outdoor mural that was created by Dirks. So the atrium is open daily from 8 a.m. to 8 p.m., and it offers that peaceful retreat to really socialize away from their rooms during their stay. And it's a special space that really allows for safe and private connections with loved ones in an outdoor area, also weather permitting. Next slide, please. We were also honored to celebrate the 6th annual Sail into Summer check presentation in the amount of $80,000. This year's event helped purchase a state-of-the-art hemocardiovascular information system, or CVIS for short, which will be part of our newly renovated cardiac catheterization lab at the Olette campus of Windsor Regional Hospital, slated to open in 2026. Next slide, please. And we also had our recent Car for Cancer event just last week. It raised over $16,000 for a grand total raised of over $93,000 since 2018 for the Windsor Regional Cancer Center. This event was started and led by Lindsay WRH when she was just 12 years old. So really an amazing event. You can see Bob on the right was our judge selection for the win. And the amazing carriage on the left-hand side was the People's Choice. So next slide, please. Amazing pumpkins if you got a chance to see those. Under enhancing an equitable workplace culture, establishing Windsor Regional as an employer of choice, I just wanted to highlight the ICU Education Fair that we had at the Olette campus. So this is a newly annual event. We've run it for, I think, the last 3 years now, highlighting key topics for our staff in critical care. So this particular one looked at Code Omega, Code Stroke, pacemakers, has interactive stations for hands-on learning. And we had a lot of hard work and dedication put in from our clinical practice managers and educators, and we had over 80 attendees. So the fair was a huge success. Next slide, please. We also had our annual Halloween decorating contest. We had over 20 departments participated between the two sites. So we've got our winners listed there. So 5 East, PACU, and the laboratory at Olette campus, and surgical pathology 4 North, and guest services at the Met campus. And there's just a few snippets of pictures there. We also were excited to host just the other day our annual Take Your Kids to Work Day. We had 44, I think, attendees, and numerous guest speakers, many clinical areas participating, lots of great questions and lots of great feedback. So we're really looking forward to continuing this on year over year. We had a brief break during COVID, so we were excited to get this going and get our grade 9 students interested in a career in healthcare. Next slide, please. So there's a lot of information on this slide, and I'm not going to read it all. I'm just going to highlight some updates for our new state-of-the-art acute care facility. The redevelopment team and Windsor Regional user groups have been working closely with the planners at Stantec Architecture and Agnew Peckham on the rules and requirements for the new build, along with early and illustrative drawings. So both key components of the eventual request for proposals. So we're just showing the stages there that we're working through right now. As I mentioned, we had the town hall on October 23rd. Stage 2 are some video highlights that we're working on right now that are department specific. And then we'll be hosting open houses and room level drawings that our clinicians and frontline staff will be participating in. We've had over 1,450 survey responses for our corporate rebranding and renaming engagement initiative. So that's really great engagement. Lots of participation from staff, patients, community members, and our regional partners. We've had a number of workshops across the community, including Open Streets Windsor, Rise Above Community Health Conference in the St. Clair College. There was a Multicultural Council event on November 5th, which was just yesterday. And we are still promoting the survey online. So again, it's open until December 15th. So if you have not yet participated, please do share your feedback. We're really interested in getting as much feedback as possible. Next slide, please. And then I think I'm handing over now to Nicole for this next slides.
Thank you, Karen. I'm just going to provide my first board report as the Chief Nursing Executive. So I'll be focusing on two topics. Two of the strategic directives with over a few different topics. So the first one is strengthening the processes that drive proactive and inclusive culture of patient safety and quality care. So as you see, we're entering the 25-26 respiratory virus season. Windsor Regional Hospital continues to monitor trends using the Ontario Respiratory Virus Tool, which is a comprehensive resource that tracks COVID-19, influenza, RSV, and other respiratory viruses across the province. For the week of October 12th to 18th, which was the most recent up-to-date data when this report was created. COVID-19 was at 5.6%, declining activity since mid-September. Influenza with both H1 and H3N2 circulating at 0.5% and RSV at 0.4%, with rising positivity with children under 5. So we are seeing sporadic cases in hospital, and I do have some updated stats because this was written a couple weeks ago, but as of yesterday, the current in-house numbers in the hospital are actually 6 COVID, 1 flu, and 1 RSV, which is a pediatric case. So a little bit of an update from when this was provided. And of course, don't forget to practice the good respiratory etiquette as shown here on this slide, covering your mouth and nose with a tissue, cough into your sleeve or elbow. You may want to get some more masks if you're having symptoms and you're out in the community, and washing hands often with soap and water. And if water is not available, using an alcohol-based hand rub. So we have the Public Health Ontario links up, and that is their official documentation for flu season. So please check those out. Next slide, please. And so in addition to our usual respiratory surge planning, we kicked off our staff flu vaccine clinics last month in October and continuing into this month in November. This is a collaborative effort between pharmacy and employee health, and the clinics are a key part of our prevention strategy, helping the staff protect themselves and patients during a time of heightened respiratory illness as we go into the cold and flu season in the winter months. The uptake so far, and again, these stats were from a couple of weeks ago, but even at that point, we had over 700 staff vaccinated with our clinics, continuing in on-unit clinics in November. And of course, vaccination is still the best way to prevent influenza. And the WeChew website is there, www.wechew.org, and they have some news releases for information on reducing risk associated with the respiratory season, including RSV and COVID, and ontario.ca for pharmacy vaccination sites, as these are available at community pharmacies. And again, the links are provided. Next slide, sorry. Can't read my mind. So for strategic directive number 5, enhancing the collaboration and strengthening partnerships. So the 2025 measles outbreak presented a significant public health challenge with over 2,300 confirmed cases province-wide, with an incident rate of 15 per 100,000. As you can see, Windsor-Essex was disproportionately affected with almost double the per 100,000 rate at 33.3 per 100,000. So that's quite a large difference from province-wide. The last outbreak case in our region was in July, followed by some additional non-outbreak cases. The actions we took following the outbreak focused on keeping patients and communities safe, working with WeChew and Erie Shores Healthcare to coordinate efforts to ensure that cases were brought in safely to the hospitals, limiting exposure due to the highly infectious nature. We also discontinued visiting for children under the age of 16, although compassionate circumstances were allowed on a case-by-case basis. We did lift the outbreak, we didn't do that. Public Health lifted their outbreak status on October 6th, and now has been adjusted to only having restrictions for ages under 16 in pediatrics, and our visitation hours have been changed as well. So that is the information there to call the hospital to if people are planning to visit with measles or a suspected measles case to help with the coordination, and the phone numbers are provided in the presentation. Next slide, please. The gestational diabetes program is transitioning, a successful transition to the Windsor-Essex Community Health Center, now offered through the Diabetes Wellness Clinic. This move enhances accessibility for expectant mothers across the region, ensuring they receive high-quality community-based care from expert nurses and dietitian. This program provides personalized education and counseling and support to help manage gestational diabetes and reduce risks for both mother and baby. The transition reflects the shared commitment to integrated care and strong partnerships across Windsor-Essex. Referrals can be made by obstetricians, midwives, and family physicians, and endocrinologists. And the website is there at the bottom, wechc.org, and more information is provided at the website. And final slide. So finally, some ending on a high note, we have a new career page specifically for our DI program. It's launching just in time for MRT week this week to support recruitment outreach. Recruitment in DI continues to present some challenges consistent with broader trends across the sector, and we are promoting it on our social media this week to help raise awareness for our DI opportunities and incentives. And we have the link to the incentive program and the DI page there. So thank you. And that is the end of my report, Mr. Chair.
Thank you, Nicole and Karen. Are there any questions? Seeing none, we'll move to the next point on our agenda, and it's the Schulich report. And Dr. Jacobs is with us tonight. Dr. Jacobs.
Thank you very much, Mr. Chair. My pleasure to be presenting again. A couple of very brief updates just for FYI notice, and then one good bit of good news that I wanted to share as well. From where we are at the school, our fourth-year students are in the process of finishing up their electives and applying for their residencies. High stress period for them, certainly, but we're quite excited and quite optimistic about their plans. And so looking forward to updating you on their successes, and certainly on the successes of our local programs and recruiting new graduates to our programs as well. The good news story is actually the metrics on recruitment and Windsor-Essex as a whole. So I keep statistics at the school with respect to the human health force, with respect to physician recruitment, really since before the school started into where we are today. And I periodically get those pulled from the ministry. I can tell you that when the school opened the full-time campus here in 2008, Windsor-Essex had the second lowest rates of access to physicians in Ontario outside of the north. So pretty miserable. When you look at our increase, which has been consistent and persistent over the last several years, we're now, since 2009, 52% increased with respect to family medicine and specialty care. So a really significant number. When we sort of trend that graph, the slope has increased above the provincial average as well, which means that we're doing better with our recruitment here actually than we are across the province. So that is quite exciting for us. From an absolute number piece, though, I think this is my favorite stat. In 2009, 39 family doctors in Windsor-Essex were trained at Western only. And as of this year, it is now 154 trained at our school and working in our region specifically. So that's an absolute increase, which is what is really why we're here, to be honest. So it is exciting. I'm very happy to see that, and certainly it has been a lot easier to do our job over the years of late because of the increased number of physicians, but more importantly, it's much better for our patients. So happy to share that information with you. Happy to take any questions if there are any. Otherwise, that's the end of my report.
Thank you, Dr. Jacobs. Are there any questions? Seeing none, thank you again. Oh, yes, Cynthia.
Not a question, Mr. Chair, but I just want to say to Dr. Jacobs that those are good stats for our Windsor-Essex area. So great job. Thank you.
Pleasure. Thank you.
Are there any other comments or questions?
I have a question, Chair. I just
Yes.
uh,
Nadine.
Hi, thank you. Sorry, Dr. Jacobs. I just wanted to ask: do you that number that you shared as to where we are now? Do you see that being steady? Do you see that number increasing?
I mean, we always wanted to increase. There's no doubt that despite us being a lot better than where we were, we're still not where we need to be. Many people still don't have access. And so we're not done from the recruitment piece, certainly. And, I think that the nice thing about having an increase to that critical mass is that it's less daunting now to say, I'm going to come and set up shop. When you know that you're going to be sort of on your own and you're not going to have your resources and you're going to be maybe working harder than you would be working in other places, it does scare people away. And as we start to increase our numbers and become a bit more, it becomes more palatable, I think, to come. And we're certainly seeing that. So we're not done, certainly. The nicest thing, though, Nadine, honestly, is that when you look at the slope of increase, we've not slowed down. So it really is wonderful news.
Well, thank you. It's great.
Yes. Other questions or comments? Seeing none. Thank you again, Dr. Jacobs. Yes, great information and a great situation for our area. Thank you. We go now to number 6, the financial presentation, and Chris.
Thank you, Mr. Chair. As it's pulled up here, I'll get started on it. Thanks. If we can head right into it, Matt. The net position for us at this point is still not. It's great news from what we had originally projected. It's still a deficit, though. So the net deficit after building amortization is a little over $15 million, which is 1.25 better than what we had projected. So it's better than our budget, but again, there is that deficit there. You'll notice that net building amortization, there's a decent variance in that. We expect that to kind of shrink down as we start amortizing and capitalize the LINAC project in the coming months. And as you can see at the bottom, hospital margin is negative 11,326,000, which is still 666,000 better than the plan. So we can go to the next slide there. We'll talk about some of the variances that we're seeing. Salaries and benefits continue to trend positively and in a combined surplus of 140, a little over almost 1.5 million there with salaries and the benefits there. Medical staff fees are a 1.164 million deficit, 100,000 or $1 million of those in offsetting funding from emergency and NICU alternative funding and patient services revenue for diagnostic services. The medical and surgical supplies have a surplus right now at this time of 627,000, mainly in the perioperative program with lower than planned volumes happening there. Drugs have a $470,000 surplus year to date, and other supplies is a little smidge over $1 million deficit. There's no offsetting revenue here. Again, our biggest pressure points end up continuing to be building and equipment maintenance, patient transportation, contrast media, and physician recruitment costs in that area. Going on to the next slide here, we're going to look at the metrics for sick overtime hours at the locations versus over target. The sick percentage at both campuses continues to be above the target of 4.8%, with Met at 6.1 and OLED at 6.2. Overtime percentage at Met campus is 4.3 and OLED is 7 versus the target of 4. So we're still, I know the group in HR and whatnot are still working hard at those numbers and getting them in line. So next slide we'll go into is the sick and overtime benchmarks for the non-union staff. For the month of August here, you can see that, and into September. The sick percentage is 0.1 below the 1% below the target of 2.2, and the percentage of overtime is 0, which is the target for that group as well. So that would be I think there's one more slide there. We can go to the next one, please. That'll show that information there. So again, the sick time, you're 1% there through September, and our overtime is negligent. There is nothing. So that is the summary as it stands now. So I thank you for that, Mr. Chair, and I would like to move that and the included minutes in the the package for the results for the Finance and Audit and Resource Committee.
Okay, thank you, Chris. So moved by Chris. May I have a seconder? Mary Dawson. Are there any questions? Seeing none, all in favor? Okay, it's a motion is passed. We are now going to correspondence and printed material, the media report. It's for your information only at tab D. And are there any board questions, board member questions or comments at this point? Notices of motions. Seeing none, the date of our next regular board meeting will be Thursday, December 4th, 2025. It will be an in-person meeting at the Met Auditorium. So at this point, I will need a motion to move for the adjournment. So moved by Anna and seconded by Chris. All in favor? Thank you. Motion passed. We will adjourn for a few minutes and meet again at 15:50 at 5.